City of Dallas, along with the Indian American CEO Council and the Dallas Foundation, are currently doing a lot of work to send back help to India. You are one of the people that is leading this initiative. So I'd love to ask you to just begin this interview. What is the Indian American CEO Council and what's the mission of it?
Uh, Aditi, there are many organizations we have who are enhancing and supporting the cause of Indian Americans and the global trade between it. A few years back, me and my friend Sanjeev Yajnik, who is president of Capital One Financial Services, we got together that can there be an organization which is, Indians today, they have broken the glass ceiling, as we know. They are leading CEOs of various major corporations. So, what can we do to create an organization which is C-suite and which can enhance the brand of Indian American? And that's where came the idea of Indian American CEO Council, and we formed it around 3 years back, and really very happy. We feel, I think, organizations are doing some phenomenal work, but this was something we can add and enhance more to what was happening with Indian Americans here in USA, and to enhance the trade relationship between the two countries.
Right. It's so important to celebrate the Indian American CEOs that we have across the nation. They're doing such a great job. You are the chairman of the Indian American CEO Council, and you, along with Dallas Mayor Eric Johnson, have raised $1 million for COVID relief in India. I'd like to ask you, could you give us an insight into what this initiative is and how did it come around?
So around 2.5 weeks back, I met Mayor in another social event, and he's a good friend of mine. And we talked about, of course, India, what was going on, and his first question was, Arun, what can we do to help? And then, Aditi, as you know, there are various organizations who are doing phenomenal work. I can name so many of them. So I told him, Mayor, there's so much happening. And he said, let's do a city to city match. And, Dallas received help when it needed. So it is our time to give back. And, those words were music to my ears. And I just seized on it. So he gave me responsibility to see what the matching city would be. And this is how this project started. And really very fast and furious, because the need was fast and furious.
Right. And you picked Jaipur as the city to send all these supplies and help to. I'd like to know what is happening on the ground there right now, and what are the conditions of hospital and clinics? What are you hearing?
This, it just seems like this is constantly the news which comes to you 5 minutes back might not be the same which you'll hear in next 5 minutes. As on today, they say the COVID cases are going down, the hospitalization has normalized, but the normalized in India, what they are saying is not the normal we are used to and fortunate to have it here. People still have to wait for, if not days, hours to get an ICU bed. The oxygen situation has improved tremendously, but as you might have heard, there's a new post-COVID syndrome of this black fungus.
Right.
And that just, one pandemic has created another epidemic. So now cities are fighting that, and Jaipur is part of that as well. And Jaipur is actually one of the 4 cities which got affected by black fungus more significantly than others. I don't know the reason of that, but I think they were affected very significantly.
Right. And what kind of supplies have you sent so far to Jaipur? And how is this whole program working? Because I'd like to look at the transparency of things. How is the money traveling? And how are they getting help in India?
So one thing, the reason, we selected Jaipur was that we did not want to make an absolute donation in terms of money, because again, as you said, not only the transparency, but we wanted to see where the need is really being used. So rather than giving money to fund the chief minister's fund and all, we totally partnered. Health minister of Rajasthan, Jaipur, was very, very responsive. he created a team. So we sent our first set of concentrators, which they are, though the need went down, but still, I think there is now they're saying there is going to be a third wave, and which is being distributed by them. Besides, now Red Cross is a global society. So the PPE we with, so we are partnered with Red Cross. Some of them we feel we will be proactively ready of the PPE and other needs when they are now saying the third wave will come. So, and they are going to use, along with the consultation of the health ministry and even the Rotary over there, to see how it gets distributed. And so that way, not only there's a total transparency, but even, people have participated and they would like to know, what difference they have made, and we owe it to them.
Right. And is it being sent to hospitals, clinic, or is it being given to the public? How are the supplies being distributed across Jaipur?
So the concentrators are going to the hospital. Through hospital, they are giving it to wherever the need is. Day before in a call, I was told now they are trying to set the concentrator bank in every rural district around Jaipur, and some of our concentrators are going to be used there. So, at the tehsil or whoever the sarpanch is, he is going to have concentrator. That way, if they can't get to the hospital, at least they would have oxygen supply.
Yes, and this oxygen issue is so dire right now. It's spreading across rural India, and only time will tell what the impact is. I'd like to focus a little bit on the underserved communities of Rajasthan and Jaipur. What is the condition of those communities right there? What are you hearing about them? And are you also focused on sending some help back for those communities?
Yeah, so as I said, the matching was with the city of Jaipur, but Jaipur, is the rural Jaipur, which is the communities you're talking, they are part of this initiative. The biggest thing I have realized is that, there has been a good work in terms of infrastructure has been built. There are hospital buildings, but there is no healthcare workers. The shortage of doctors, shortage of medicine. So people are taking it on their own. In a lot of cases, they are not even being able to test it and diagnosed.
Right.
So some of the help, I feel, basics, which are help which is going, that's going to help them, because you don't need a doctor to really, if you're short of breath and your oxygen levels are going down, you don't need a doctor. These are very easy to use. So hopefully that will help them, to get to reach the nearest destination where they can get help and save their lives.
Right. And you have raised $1 million, as I said before. Are you trying to raise more? How is this initiative going? And if you are raising more money, where will that money go?
Well, right now, Dallas Foundation, as you mentioned, has partnered with it. I think we'll keep it open for a few more weeks. And what really was gratifying was, like, there were people calling our office. That just shows the philanthropic nature of, Americans. And we feel people, like, there were donations were $25, $50, and people were calling our office when they saw mayor's initiative, when he tweeted and he mentioned it in press conference, that we can't donate, but what can we do to help? And these are not, I'm not talking about Indian Americans, I'm talking about people who might not have ever traveled, but they are willing to help. So to answer your question, we'll keep it open, and based on what we are working with, it's a very ambitious project, Aditi, and if we get to that level to create a permanent ICU, they say third wave, there is still shortage of ICU beds for children, and we are working towards, if we can have enough traction, to build a 200 bed ICU center for children in Jaipur.
Oh, wow.
Again, it's ambitious, and we hope we can achieve it.
Yes, and I hope you do achieve it. This collaboration between the Dallas Foundation, the Indian American CEO Council, and the city of Dallas with the mayor, how has that been for you? And, how are they all feeling being a part of this collaborative effort?
How, when, as they say, if you want something to make happen, all the chips, they fall together. Mayor, I would say he is a true global citizen. When he became mayor 2 years back, his true initiative. His vision was to change Dallas into a global city, but pandemic really didn't let him do much travel. And this is his first great initiative which he has taken. And Dallas Foundation president and chairman, his wife is an Indian American, and I did not know that till the time we announced. And then Matthew, he said, it's so personal to me because I'm here every day. So many of, my wife's family member, they could not survive. So I said, oh my God, see how this all is coming together. And that's the power of Indian American today. Like we are visible in every aspect of society. So if we reach out, and one thing which Mayor acknowledged that Indian Americans are contributing the most here when we need it. When Dallas, Texas had a weather storm, Indian Americans came forward and, for water supplies, the need which has happened. And he mentioned that, okay, this is our time to give back. We are global citizens. So again, I think it's very humbling and gratifying experience how when the need is there, people are coming together to help.
That's so important, and congrats on the collaboration. I just have two more questions left here for you.
Yeah.
These relief efforts that are happening in India, how are the beneficiaries responding to this effort? I'm sure you must be hearing about what's happening on ground when all of these supplies are being sent. What's the response been?
Aditi, I don't think right now they are at the stage of whereas they can even respond because it's like you are grasping for your life, your loved one's life. So they are taking the help from wherever they can. I'm sure subconsciously they're very thankful from where it is coming or what it is happening because not enough can be done. And truly saving a life. For someone who just cannot breathe and all, they have to be thankful. But are they, are you hearing them sending you thank yous and all? That's not even needed. But I'm pretty sure. I think they are thankful.
Yeah, I'm sure they are. You're being watched by South Asians all across the nation right now. What's the
Okay.
message you like to give them on giving back help to India? And I'd love for you to give a message out to families that have lost a loved one as well.
Well, as they say, loved ones are never too old to go away. So it's always hard. I know how tough it is right now. Every morning, I'm sure most of the South Asians and Indian Americans they are scared to look at their phones in the morning, not to see any bad news. All and we little we can do. There are so many organizations which are doing so much good work. The next biggest social challenge is going to be, which I'm sure you're reading about the orphans which have been created by both parents being died. So this thing is not getting over today, even if the corona goes away. So keep all of them in your thoughts and do whatever little you can.
Yeah, so important. And people can go on dallasfoundation.org to donate more for this cause. Thank you so much, Mr. Arun Agarwal, for your time on ITV Gold.